This question is primarily based on antihypertensives use in pregnancy and antihypertensive drugs. That's the one-liner with which this question has been derived. A 26-year-old female came to the hospital for pre-conception counseling. Patient is not pregnant yet. Patient is a known hypertensive, compliant to drug therapy. Compliant means if a patient is under therapy, patient is continuously taking that tablet. उसको हम कहते हैं compliant to drug therapy. Which of the following drugs will you advise to stop? किसको stop करना पड़ेगा यहाँ पर? We have 4 important tablets here: Methyldopa, Labetalol, Lisinopril, and Nifedipine. I have looked into those values, my dears. Most of you have went for the correct option. The answer for this question is Lisinopril. See, when you come across this kind of questions, for example, here they are not asking which drug should be given for the patient. यहाँ पर कौन सी दवाई दे सकते हैं, ये नहीं है सर क्वेश्चन. किसी दवाई हम नहीं दे सकते हैं. That's the question over here. Which tablet should not be given? When you come across this kind of a question, just say it out inside your heart that this is a negative phase question. Just say it out loud to prevent the silly mistakes from happening. When after finishing the reading of every individual question, you have to say it out loud whether it is a positive phase question or a negative phase question. अगर नेगेटिव फेस क्वेश्चन है तो हम ऑड मैन आउट जो है ऑप्शंस में उसको चूज करना पड़ेगा, which means all of these things are going to be utilized except one. Well, that's how we have to approach, we have to prevent the silly mistakes from happening. तो अब क्वेश्चन देख रहे थे, आफ्टर टेकिंग द क्वेश्चंस अब हम लोग बता सकते, we came to know that it's a negative phase question. Good. Which drug should not be given in this particular case? Answer is Lisinopril. Now, why Lisinopril is not administered? Why Lisinopril is not administered? Because it might produce renal damage in the fetus. It might produce renal damage in the fetus. We'll utilize this point to explain a little bit further. What are all the drugs which can be safely administered in pregnancy? हम लोग यहाँ पर antihypertensive drugs देख रहे हैं. Which antihypertensive drugs can be safely administered in pregnancy? एक mnemonic है यहाँ पर. Pregnant hypertensive lady chooses Dolo. Pregnant hypertensive lady chooses Dolo. This is the mnemonic for it. We have multiple other mnemonics which is roaming out, but it contains only few drugs. We have multiple other drugs which can be safely given in pregnancy, which is not included in the usual mnemonics. तो इसलिए हम लोग एक बड़ा mnemonic है, but don't worry, we're not going to be talking about a lot of other drugs, just those drugs which is important for the exams. From the mnemonic pregnant hypertensive lady, you will know that this mnemonic is for pregnant hypertensive women. Pregnant is for prazosin. Prazosin आपको पता है ना, prazosin एक अल्फा ब्लॉकर दवाई होगा, और हाइपरटेंशन के मतलब that's the mnemonic, you know. So hypertension. Lady, LA is for lazine drugs. Lazine drugs are simple hydralazine agents. Hydralazines. DY stands for dihydropyridines. What are those? Dipin drugs. Dipin drugs are there like Nifedipine, guys. Dipin drugs like Nifedipine or any other dipin agents which can be utilized for hypertension. And the chooses is for clonidine. Chooses is for clonidine. हमारी अल्फा 2 agonistic agent होगा. और डो लो है, डो होगा डोपा ड्रग्स, अल्फा मिथाइल डोपा मॉलिक्यूल, और लो होगा लैबिटलॉल, लॉल ड्रग. और इस सब लोगों से सिर्फ लैबिटलॉल होगा ड्रग ऑफ चॉइस. अगर एक प्रेग्नेंट वुमन है आपके पेशेंट और हाइपरटेंशन में पहुंच गए तो ट्रीटमेंट के लिए हम लोग लैबिटलॉल दे सकते हैं. दैट इज द करंट ट्रीटमेंट ऑफ चॉइस. बट इफ अ पेशेंट इज सफरिंग फ्रॉम hypertension or pregnancy, hypertension, then we can go with labetalol. But if the same patient is also suffering from bronchial asthma, this is the most important one, guys. A same patient is having multiple comorbidities, a pregnant individual with hypertension with bronchial asthma. यहाँ पर हम लोग labetalol नहीं दे सकते हैं क्योंकि ये बीटा ब्लॉकर और अल्फा ब्लॉकर भी होगा. Labetalol molecule एक both alpha 1, beta 1 and also a beta 2 blocker. क्योंकि यहाँ पर बीटा 2 रिसेप्टर भी ब्लॉकेड हो गई तो पेशेंट्स को ब्रोंकियल आस्मा अगर सिम्टम्स है तो बढ़वा गई. That's the reason why we cannot administer labetalol for a patient with bronchial asthma. Instead, we can opt for dihydropyridines. ये होगा drug of choice. So if a patient is suffering from प्रेगनेंसी, हाइपरटेंशन एंड ब्रोंकियल अस्थमा, यहाँ पर होगा DHP डाइहाइड्रोपायरिडन्स विल बी द ड्रग ऑफ चॉइस। सिर्फ प्रेगनेंसी और हाइपरटेंशन होगा तो ट्रीटमेंट आंसर होगा वहां पर लेबेटलॉल। अगर प्रेगनेंसी, हाइपरटेंशन और ब्रोंकियल अस्थमा, आंसर होगा डाइहाइड्रोपायरिडन्स। गुड। So the answer for this question, which of the, so again, हम लोग क्या कर रहा, we have to do what? We have to look into that question. We have to come up with this negative phase question. So we have to find out the odd man out. The answer for this question is lisinopril. और mnemonic जो है हमारे पास, no, pregnant hypertensive lady chooses dolo. From that we can easily understand that methyldopa can be safely administered. Labetalol is the drug of choice. Nifedipine also is the drug of choice with bronchial asthma comorbidities. So all these three drugs are not there. The answer is option C, which is lisinopril.